The human brain is a remarkably complex organ responsible for controlling our thoughts, movements, emotions, and so much more. Brain tumors arise from the abnormal growth of cells within the brain tissue, and these growths can either be benign or malignant. While benign tumors grow slowly and typically don't spread, malignant tumors can be quite aggressive, invading surrounding brain tissue and posing a serious threat to health. Brain tumor surgery is often a crucial step in the treatment journey for individuals diagnosed with these conditions. The primary goal of surgery is to remove as much of the tumor as safely possible, alleviating pressure on the brain and improving neurological function. Surgery can also provide valuable tissue samples for biopsy, allowing doctors to determine the specific type and grade of the tumor, which is essential for guiding further treatment decisions. Advancements in surgical techniques, imaging technologies, and neuroanesthesia have significantly improved the safety and effectiveness of brain tumor surgery, offering hope and improved outcomes for countless patients. When it comes to brain tumor surgery, there are two primary approaches: craniotomy and neuroendoscopy. Craniotomy involves creating a small opening in the skull to access the brain and the tumor within. This procedure is typically performed under general anesthesia, ensuring the patient's comfort throughout the operation. Neuroendoscopy represents a minimally invasive alternative to craniotomy. This technique utilizes an endoscope to access and remove the tumor through small incisions in the skull, or even through the nasal passages. Neuroendoscopy offers several potential advantages over traditional craniotomy, including reduced pain and scarring, shorter hospital stays, and faster recovery times. Craniotomy remains the gold standard for many brain tumors, particularly those that are large, deep-seated, or located in areas that are difficult to reach using minimally invasive techniques. The decision of whether to proceed with craniotomy or neuroendoscopy is a complex one, and a multidisciplinary team of neurosurgeons, neurologists, radiologists, and other healthcare professionals work together to determine the best course of action for each patient. Craniotomy, a cornerstone of neurosurgery, allows surgeons to access the brain to treat conditions like tumors. The procedure begins with general anesthesia, ensuring the patient remains comfortable. The surgical team positions the patient's head for optimal access. An incision is made in the scalp, exposing the bone. A bone flap is removed with a surgical drill, creating a window into the brain. The surgeon uses a microscope to navigate and preserve vital structures. The tumor is carefully dissected with the team monitoring vital signs. The bone flap is reattached with titanium plates and screws. Neuroendoscopy is a groundbreaking advancement in neurosurgery, offering a minimally invasive alternative to traditional craniotomy. It uses an endoscope with a high-definition camera and specialized tools to access and remove tumors through small incisions. Real-time images are transmitted to a high-resolution monitor, providing a magnified view of the brain's structures. The minimally invasive nature of neuroendoscopy means less pain, reduced scarring, and faster recovery. Patients often experience reduced risk of complications, such as infection and bleeding. The human brain is a marvel of complexity, responsible for a vast array of functions that define our very essence, from our thoughts and emotions to our movements and senses. Brain mapping, a sophisticated technique employed during brain surgery, plays a crucial role in preserving these vital functions and minimizing the risk of neurological deficits. Prior to surgery, patients may undergo functional MRI or other imaging studies to identify the location of critical brain regions involved in language, motor control, sensory perception, and other essential functions. During surgery, brain mapping is performed to confirm the location of these areas in real time and to guide the surgeon in safely navigating around them. This involves using a small electrode to deliver mild electrical stimulation to specific areas of the brain while the patient is awake and able to respond to commands or questions. Brain mapping allows for the safe removal of tumors located near or even within eloquent areas of the brain, minimizing the risk of permanent neurological damage. This technique has revolutionized brain surgery, enabling surgeons to treat tumors that were once considered inoperable and significantly improving outcomes for patients. The journey after brain tumor surgery is unique for each individual, influenced by factors such as the type and location of the tumor, the extent of surgery, and the overall health of the patient. Recovery is a gradual process, and the focus shifts towards regaining strength, independence, and neurological function. Immediately after surgery, patients are closely monitored in a specialized neurosurgical intensive care unit or step-down unit, where their vital signs, neurological status, and pain levels are carefully managed by a team of experienced nurses and physicians. As their condition stabilizes, patients are transitioned to a regular hospital ward, where they begin to participate in rehabilitation therapies tailored to their specific needs. Physical therapy focuses on improving mobility, balance, and coordination, while occupational therapy helps patients regain skills essential for daily living, such as dressing, bathing, and cooking. Follow-up care is essential for long-term health and well-being after brain tumor surgery. Regular checkups with the neurosurgical team allow for close monitoring of recovery progress, assessment of neurological function, and early detection of any potential complications or tumor recurrence. Brain tumors can manifest with a wide range of symptoms, some subtle and easily dismissed, while others can be more pronounced and debilitating. Recognizing early warning signs and seeking prompt medical attention are paramount in ensuring timely diagnosis and treatment. Persistent headaches, seizures, vision changes, and difficulty with balance should never be ignored. Experiencing these symptoms doesn't necessarily indicate a brain tumor, but it's best to consult a healthcare professional. Early detection allows for timely intervention and potentially improves treatment effectiveness.